Okay, so let's go on to this other interesting topic, which I find, fascinating that you're interested in: babies without nappies. I've seen something on this in one of the birthing movies that I've watched. But when you say raising baby without nappies, what age are we talking about?
Well, you can start from the newborn age. I mean, it's basically the idea. A lot of my material comes from anthropology, from comparative biology, looking at other species. So, lots of other animals keep their babies in nests, and no animal wants the baby to eliminate in the nest. So there's always some method of taking the baby out or controlling the baby's elimination. And that's true of human babies as well. So babies have a system that allows them to communicate with the caregiver around their elimination needs. And if you've never thought about it, it's a bit of a wild idea, but once you sort of switch into it, you can actually see that babies do communicate this need. And it makes sense. The baby with a full bladder at any age is uncomfortable, so they'll cry. But we don't sort of have it on our list of actions to take with crying babies. But once you start to think about it, you think, oh, well, my baby could be having a full bladder. And then it's a matter of setting up a system of communication with your baby where you each understand each other's communication, so that your baby cries, you realise they've got a full bladder, you take them to a place and allow them to eliminate. And it's really quite fun. It's a fun thing to do. It blew me away that babies have this capacity that I never knew about.
Yeah, that's fascinating. I mean, every time I think about it, I'm like, it kind of makes sense once you think about it. But what I want to know is, really, I live in Sydney. I'm in, pretty residential, touristy area. I live in Manly, which is over the Harbour Bridge. Is this something that's really practical for someone like myself, or is this something for, let's talk about hippies again, living on a farm. Love hippies. My aunt's the biggest hippie ever, but I just wonder, is it really practical?
Oh, totally, it is, and it's. It's something that most women in other cultures do, and of course, we never had nappies or diapers till a few decades ago. So it's something that every mother and baby did until the last recent generation. So we designed to do it, and it's really about figuring out how it's going to work for you. So for myself, for example, I used a little bucket, a little like sand bucket, sandpit bucket that my baby sat on, and she peed and pooed in that. I used a laundry tub, so she peed or pooed in a laundry tub. I did use nappies or diapers part-time, but I was always really careful when she was wearing them, so she hardly ever eliminated in them. It can be helpful to not have carpets at some stages when your baby starts to walk. But when they get to the walking stage, you can use little pull-ups, little pull-up disposables or pull-up cloth pants, and if the baby pees, well, you just change them. So there's lots of ways around it. But the thing is, as I said, it doesn't have to be all or nothing. Right. So if you're a new mum, or you've got a baby under about 6 to 12 months, you actually know when your baby's going to poop. The look on their face, the squirming, the noises, yeah?
Yeah.
What you do is take their nappy off and sit them on something that they can poop in. And, as far as peeing, the most, like we all pee when we wake up, and that's true of babies too. So when they wake up, you take their nappy off, sit them on a little something, and it could be you could be holding them over a tub. There's a particular little squatting position you can hold them in, or you can sit them on a little bucket or a little potty, and they'll pee, and the easiest way to do that, to sort of get this communication going, because one of the names for it is elimination communication, is to use a sound or a noise that is associated with it. So with my baby, I use the psst noise, which is a great one for starting anyone to pee. So, when I wanted her to pee or poop, when I observed that she was peeing or pooping, I'd go psst, and then she associated that with it. And then when she was 3 months and I found out more about it, I held her over the laundry tub and I went psst, and she just peed.
Oh my gosh.
That's the noise with the action, and then you use that as a means of communication. And once the babies get the hang of it, or get the idea that you're going to respond to that need, then they'll actually hold on and they'll actually signal more clearly. So they'll cry, or some people actually use hand sign language with their babies, because babies can do that before they can talk. So there's a sign language for potty. Yep. And it's once you get into the swing of it, the baby, you can get this really clear communication going. And even, like I said before, that intuitive connection that you have with your baby. And I used to know when she needed to pee without her saying anything. Or I remember going to a playgroup one time and she was in the sand pit and I was up in the kitchen and I thought, oh, she needs to pee. I just had that feeling. So you get this sort of communication going, a little bit like you do around breastfeeding. You just know when your baby needs to feed. You just have this sort of connection going. And it's the whole thing just on a different level around what comes out rather than what goes in.
What's the biggest, I guess, reason for doing it? Is it because you don't want to spend money on nappies? Is it easier? Like, why would you want to do it?
Why would you want to do it? Well, there's a whole lot of, I did it because I was sort of interested and because for me it seemed like the most, you could say natural. It seemed to be part of our blueprint really, that we did this with our babies. And some people have described nappies or diapers as walking toilets. So is it fun for a baby to sit in one of those? No, it probably isn't. And no, I didn't go in with an outcome in mind, but what happened for my baby was that about 14 months, she got completely independent in her toileting. I would just have a little potty in each room and she'd just go and sit on it. So there was a huge saving in terms of toilet training. There was a huge saving in terms of cloth or disposable diapers. I mean, just much better time for Mother Earth. We're not disposing of things. We're not even having to wash things most of the time. It was quite a big commitment for myself, and my husband, got a bit annoyed with it at times because once sort of on this track, it's a little bit hard to go off it. Although, again, some people do it part-time, or some women go to work and train their nannies in it, or, in those traditional cultures, it's actually the grandmother that does this with the baby. So there's lots of different ways of doing it. I chose to do it in the night, which is a big commitment to sit up and put my baby on the potty when she needed to eliminate. But some people just put a diaper on at night. There's lots of different ways of doing it, and I took it on as a really full-time 24/7 commitment, which was really big, but you can take it on as a smaller commitment. I mean, you can just catch the poop. When they're going to poop, you just catch the poop when they wake up in the morning, and that's pretty fun and pretty easy. And if your baby's below 6 months, generally that's not that difficult. After about 6 months, some babies sort of give up communicating around it because they think, oh my God, this hasn't worked up till now, so they sort of give up. But if you've got a really good relationship with your baby and you're responsive to your baby on every other level, some babies can pick it up even up to a year. I went over to my friend's place in America, and her baby was 9 months, and we trained him in it, and she started doing it because he still had that communication, and he was relieved, you could say, that someone was responding to that need that he had.
Right. I think all I worry about is, like, especially when they're really newborn, you think the number threes, the explosions, like, I don't know if I could do it with the number threes around.
Well, that's really easy because you're just putting them in a little bucket or a potty. There's nowhere for the number 3 to go except in the potty, So it does. I mean, like over her years of toileting, I started doing it when she was 3 months, but, the number of poopy nappies was really small, 5 or 6 probably the whole time.
Oh my
gosh. I was like that. So, a big saving in washing or buying diapers, whatever you do. So, yeah, for me, I found it really fun. It was extraordinary. It blew me away. The whole thing was extraordinary. It's a whole nother level of relationship and communication and capacity that our babies have that we haven't recognised before.
Yeah. Okay. How cool.
People want to know more. There's an article on my website called Mothering Mindfulness and a Baby's Bottom,
right,
and Introduction to Elimination Communication, and at the bottom of that there's a whole lot of resources. But if you search elimination communication, it's also sometimes called natural infant hygiene, or early potty training are the different terms, or infant potty training are the different terms that have been used for it.
Great. I was going to ask, actually, is there a DVD or something you can watch? And
there's an Australian DVD called Nappy Free by Nicole Moore. Yeah, that's a great DVD. Yeah.
Okay, awesome. Thank you for that. All right, so let's talk about, you've got a new website.
Yes, I'm very excited. It's a membership website called gentlenaturalbirth.com.
Mm-hmm.
So this is aimed at pregnant women, at birth professionals. They can join up, and every week they get a video of me talking about a particular and important topic. I've covered things like early pregnancy discomforts, calculating your due date, ultrasound, why have an ultrasound, is ultrasound safe? I've done DVDs about early testing, the nuchal translucency screening, and I'm just in the middle of doing a series of DVDs around making wise decisions about induction, a little bit of what I mentioned before, epidurals and cesareans. So a wealth of topics, and as well as that, every fortnight I have a webinar that people can come along to for free or access the recording on the website. And I've got a lot of material on my membership website as well. I've got audios, videos, articles, and I'm adding to it all the time. And the great thing right now is because I'm just setting it up, people can just write and tell me what they want, and I'll make a webinar, a DVD on those topics. So really exciting for me, way of communicating with people and, really supporting mothers, babies, fathers, and families all over the world.
I think it's, I just went into it last night actually, and I was like, oh, okay, we better go and have a look at some of these videos. And even just the first one I was watching was about the calculating a due date. And I've done an article on this before, and and even when I was pregnant, I was like, oh, do I just tell people the wrong due date? Do I just tell them a few weeks in advance so I don't have that pressure? Or I was even worried about, has the midwife at the hospital, I was in a midwife program, has she calculated my due date correctly? Because, is my cycle 28 days, or is it, can that alter due dates and things like that? So I found that video really interesting.
Oh, great. Yes, and there's even a way of calculating your due date by the moon in there.
Yeah.
I want to go with the numbers.
yeah, that was really cool, very cool. So I think sometimes, people get so fixated on, even though we know it's the estimated due date, we know it's an estimation, but still it's that we don't hear the estimated, we hear the due date. It's that the language that is used in birth can sometimes get people fixated on the wrong things, I think.
I think that's right, and you're right, estimated is really important. And babies, as I said before, babies will come in their own time, and we don't want to get too fixated on a date. And I know that's sometimes tricky, especially with your first baby, because we're used to planning things and having a date, and, birth is one of those things that just, doesn't function like that. It happens at its own time. And again, I think that it's actually really good training for parenthood, because parenting is like that. Children do things in their own time, no matter what our particular agenda is. And, when we can really trust our bodies in birth and trust things to unfold at exactly the right time, at the peak of readiness, I think that's a really good experience for mothers and babies. And, as I say, don't push the river, it flows by itself. And, when labour and birth happen in their own time, there's going to be a lot more ease with it. I didn't mention it before, but, there's a system that happens in the lead up to birth, and the few days before birth, the mother's system becomes much more sensitive to oxytocin, the hormone that causes contraction. So she builds up her receptors, and that means that on that day that she goes into labour, her body is maximally sensitive to oxytocin, and she's going to have the most efficient labour possible. And if she's induced at any other time before that, then the labour efficiency is going to be compromised to some extent, and sometimes compromised so much that labour doesn't even happen. You can get a failed induction if you're really that far away from labour. So, really trusting your body and trusting your baby is the essence of the message that I give in everything that I do. And I think it's really important, because in our culture, we don't hear that from other places.
Mainly information from yourself. Is it your own experience and your own expertise? Is there other people that you either bring in?
I haven't as yet. I'm intending to do that in the future, but at the moment I've got videos of myself talking about particular topics.
Yeah.
Some of the stuff that's covered in my book, some other things, as I said, anything that anyone wants to email me about as well. And we've got forums we're setting up. It's very exciting to have this available to people, and to be able to provide all the information and all my own experiences from more than 20 years of parenting, and of looking at the research, and of looking critically at what is really best for mothers, babies, fathers, and families.
And I think it's going to be beneficial for a lot of women, because you are quite relatable. It's not you're just coming from this medical view of this is what's happened, this is what we medically see, physiologically it works this way. But you've also done it yourself. You are a mother of 4, and you've had your 4 babies at home. So I think that makes you a lot more relatable than some of the other physicians.
And it's really important to me that it's not just the science, because the experience that we have in pregnancy and labour and birth are incredible experiences that can't be condensed down to science. We have these incredible intuitions, and we have these experiences of ecstasy, and it's not just about the nuts and bolts and what the research says. So that's one of the things that I think is really important to bring in. And again, it's about trusting ourselves and trusting our bodies and trusting our intuition on top of all of that.
Now, also, we, obviously a lot of people in the community here at Natural Childbirth World, we have midwives and doulas as well. So there's also a professional membership for that as well. So you've got sort of 2 membership levels, don't you? So can you just explain those?
Yeah, so the membership level for parents is really to support them through the journey of pregnancy, and those videos start from the early times, and there's information appropriate to their particular time in gestation.
Yeah.
For professionals, all of that is available to them as well. And also professionals can ask me more questions. There's more DVDs, more audios available. That'll be of interest to people that are caring for pregnant and childbearing women. And that's really important to me, to resource those people as well. And there's just a lot for me to share. And we talked about physiology before. I'm actually in the middle of writing a report on the hormonal physiology of childbearing, which is all of those hormones that we talked about. So there's a lot for me to share with birth professionals from that perspective as well. I'm really excited about that project and that work.
Wow, fascinating stuff. So you just tell us the website again?
So gentlenaturalbirth.com. You can go along there and check it out, and you can join up by the month. I have it just for the rest of November. I have a special where people can join up for 3 years. Instead of paying $27 for parents or $37 for professionals, it's $297 for 3 years. And you join at the professional level, which is appropriate for parents. You get all of the parenting stuff and some extra as well. Yeah. So you just have to put in the code PRIMAL, PRIMAL. It was a conference I just came back from in Hawaii. So till the end of November, you can use that coupon code.
Okay. And so otherwise, for parents, it's $27 per month?
That's right, $27 a month. That's
okay.
Right.
And so you can just go on, like if say you're at the late stages of your pregnancy and you just want to sort of check out some of the videos that you've done, can you just do like 1 month or?
Yes, you can do just 1 month. Probably best to contact me, because what usually happens when people start up is they go into the early pregnancy ones.
Right.
And we can arrange it that you can see the later pregnancy of the ones I'm doing right now. But when you join up for a month, you can access everything that's in there.
Okay, great. All right, well, thank you so much for chatting today. Is there anything else that you wanted to sort of cover or mention, or spruik anything else?
I just wanted to say, that my take-home message is, trust your body, trust your baby, trust birth, and that our bodies really are superbly designed, and we can tune into our bodies, tune into our babies, and we can really, we can have an ecstatic experience of birth, and that's the gift of a lifetime for yourself and your baby.
Wow, that's pretty exciting, isn't it? All right, thank you, Sarah. Dr. Sarah Buckley, gentlenaturalbirth.com is her new website. I've got it around the right way, haven't I? So go and have a look at that, and let me know if you have any questions about this audio recording, or if you like it, share it with your friends, share it with your doula. Let's get the message out there that birth is natural and normal, and it can be ecstatic, and really it's meant to be. So thank you.
Okay, pleasure, Tracy. Thank you.